If your bottom teeth are crooked and you haven't wanted to fix them because why bother if they're not visible? They're not noticeable. The top ones are fine. No one's told me. I don't care about aesthetics. I have several points that might change your mind. It's important for you to understand that the mouth is a very specific and super precise gear system. If we move any of these gears, it's going to start a complete misalignment and could be quite damaging to your muscles, the joint, other teeth, the health of your bone, your gums. I mean, it can become a whole ordeal just because one tooth moves. Now, you probably know more than one adult, or maybe you are that adult who has very straight and pretty top teeth, but the bottom ones are all crooked. And they haven't wanted to fix it because they think it's only an aesthetic issue. There's something very important here. When teeth are crooked, they present several challenges for the mouth area. Number one, if we see that the teeth are crooked, the gums will appear at different levels. This causes the periodontal ligament, the gums, the bone, to also be at different levels, which will make your hygiene much more difficult. Cleaning straight teeth isn't the same as cleaning crooked teeth, and this causes plaque to build up between the teeth. Therefore, one of the main causes of bad breath in adults is crooked teeth in the lower part, because they retain more food, more plaque, and are harder to clean. Imagine the toothbrush is straight, and if you press it against the surfaces of the teeth, there will be surfaces that it will never touch. Why? Because they're at different levels, therefore it's harder to clean and much more plaque and food buildup. And this will clearly cause bad breath. Number two, but it doesn't just stop there. These teeth that are crooked, also because they're at different levels, receive different loads. That is, when you chew, there will be teeth that don't touch, there will be teeth that touch too much. They're called occlusal traumas, and this causes the bone where these teeth are to also be lost. And remember, the gums follow the bone, and that's why you might see one or two of your bottom teeth that have more of the root exposed. And maybe they've told you it's because of poor brushing, but guess what? Most likely it's not the brushing, but rather that since you have this tooth further forward, the bone receded and the gums receded. This is very common and sadly has no solution because by the time you lose the bone, it's too late. Those gums won't recover. Number three, another thing we see very commonly with patients who have crooked teeth in the lower part is that when they make lateral movements, that is your jaw to the right, jaw to the left, and jaw forward, some teeth touch more than others, so they wear down unevenly. You see patients who have three perfect teeth and one lateral tooth completely worn down. What happens then? When they're finally aligned with braces, one tooth looks lower than the others. You have to put a veneer or a resin on it to be able to stabilize it at the level so it looks good aesthetically. But not just aesthetically, but also functionally. Therefore, when you have crooked teeth and the teeth start to wear down, get ready because that won't improve unless you get some resins later on. And you'll say, well, if I leave them crooked, then there's no problem. It's not noticeable. Well, we already saw that if you leave them crooked, you're going to have periodontal problems and bad breath issues. Therefore, it's always going to be good to align them and, of course, later correct those height discrepancies so that the tooth is functional and aesthetic. Now, there's something very interesting that happens with patients who have crowding. All teeth are held together by a pressure that builds up between the teeth themselves. That is, the tooth on the right or the left, they all press against each other and stay in place. However, when one gets out of line, the other teeth automatically push and shove it out even more. This, unfortunately, once it happens, can only be corrected with orthodontics, because when the tooth moves out and the others close in, well, you can't move that tooth back naturally. Impossible, the space is already closed. Now, if the teeth are crowded, this crowding gets worse every single day. Why? Because you can no longer move the teeth back into place, and the molars and all the forward growth that's happening causes the teeth to start crowding more and more and more and more. Therefore, making the decision today will be easier to correct than if you make the decision in 2 years or in 10 years. And that's why we see many older patients with totally crowded teeth, even on top of each other. And then they lose those teeth because they lose bone, they lose gum support, and suddenly the tooth loosens and falls out. It's very unfortunate, and all of this could have been prevented if orthodontic treatment had been done years earlier. Therefore, it's best to keep them all stable in the same arch so that the same contact point keeps the other teeth in their place and they don't push against each other. Because something else happens. When the bottom tooth moves forward and starts pushing forward, what do you think is going to happen to the top teeth? If the teeth are like this and the bottom one pushes, it's also going to push the top teeth. And one of the main, listen very closely to this, one of the main failures or fractures of the top teeth is because of the bottom teeth. When the bottom tooth moves, it pushes the top one, either pushing it forward or fracturing it. Why? Because often the bottom tooth, even if it's small, the bone is very hard and it breaks the top one. If you just got a beautiful smile design on top with veneers, but no braces on the bottom and they're crowded, watch out. Today you might not feel it, but tomorrow or the day after as they move, there'll be a collision. It could break your veneer, your resin, or push the tooth, and suddenly you'll say, hey, my top teeth are out of alignment. Why? Well, because the bottom ones pushed them. Therefore, you have to be very careful if you had a smile design on top, got veneers, or simply have straight top teeth and don't want them to move, because the bottom ones will move them sooner or later. Now, there's something very interesting that happens with the bite. Today, your bite might be very good, but if the front teeth are moving, are crowding, the molars and premolars are also going to tilt forward. Therefore, your bite, which is very functional today, might not be tomorrow. And suddenly you say, hey, look, I've been feeling for a while like I'm hitting this part first instead of all the rest, right? How strange. You go to the dentist and, no, well, your bite is fine. Or, yes, look, you have a high point, and they touch it a bit and that's it. You bite well now, perfect. Months go by and you feel it high again because the tooth keeps tilting, and when it tilts, imagine it goes out of alignment and starts to collide. What can that cause? It can cause you to have some bruxism, to start clenching your teeth because you feel like something isn't right there. It could be that you feel a different collision and then you move your jaw, and by moving it, your jaw starts to hurt, you have pain. It's like having a nail in your foot. Sooner or later, your foot might not hurt, but your ankle, knee, or hip will, because you're trying to adjust your foot to avoid stepping on that nail. So it's very important that if you have a high point of contact, it gets adjusted. But if you're adjusting it without correcting what's causing the problem, tomorrow it'll be the same or it'll be another tooth, and eventually you'll end up with all your teeth flat, worn down, or with joint pain. Therefore, it's also important to fix this so you don't have those interference points from the bottom or top teeth on the molars, which later cause joint damage that can be temporary or permanent. As you can see, this isn't just an aesthetic problem. Look, we're talking about functionality, we're talking about receding gums, we're talking about bone loss, we're talking about teeth that move and touch in the wrong places, which can cause joint pain, can cause headaches, and can even cause ear problems. All this because the teeth move and start touching in places they shouldn't be touching. We're talking about bad breath because dental plaque builds up in places you can't clean. We're talking about excessive tartar buildup. You shouldn't be showing up for a dental cleaning with that much tartar. No, it's not normal. But when patients have teeth so crooked they can't clean them, it's obvious they'll arrive with very dirty teeth. Therefore, straightening your teeth isn't just an aesthetic issue, it's a functional, biological, and health issue. And it'll help you prevent other future problems that are much more costly than even orthodontics right now. So this is prevention, it's interceptive dentistry. We're going to try to correct a problem that'll become much bigger later. And what's better is that indeed it'll also look great aesthetically. So if this video made sense to you, if you have a friend with very crooked teeth who's told you they don't want to fix them because it's aesthetic, or yourself or your partner, a loved one, send them this video. Leave us a comment too if you have any questions, and subscribe to the channel because it's a channel designed to improve your oral health and your health in general, of course. See you in the next video, and I hope you're doing very, very well.